Good morning, everyone. I'm Tina, the Diabetes Nurse Educator from Admiralty Medical Center. Thank you for joining us this morning to find out how technology can help with the diabetes care. This morning, let us find out about what is diabetes technology, how can you make use of technology to improve your diabetes care, and what technology is available to help with the diabetes management. Let's begin our journey to find out what is diabetes technology. Diabetes technology is used to describe the hardware, devices, and software that people can use to manage their diabetes. These can range from changes to lifestyle as well as monitoring and managing blood glucose level. Diabetes technology can broadly classify into glucose monitoring, insulin delivery, and mobile applications. Have you ever wondered what technology is available to help monitor your blood glucose level? Flash glucose monitoring is a device that uses a sensor paired with a reader or a smartphone to detect your blood glucose level via interstitial fluid. One such example is Freestyle Libre, which you can find at numerous pharmacies in Singapore. Users of Libre can share their data with healthcare professionals if they wish to by downloading the LibreView professional account. It can also allow caregivers to monitor their loved one's glucose reading anytime, anywhere by downloading Libre Link Up. Flash glucose monitoring can help you correlate your blood glucose pattern with your food, exercise, and medication, and to see how your food and lifestyle choices can affect your glucose level. This gives your healthcare provider more information to better understand your glucose pattern in order to personalize your diabetes treatment. An advantage of using flash glucose monitoring is that it is painless, convenient, and is flexible as you can shower, jog, swim, or perform resistant exercises with it. It also reduces the need to do finger pricks. However, the sensor has to be worn on your arm for 14 days and glucose readings can differ slightly from finger prick reading. Continuous glucose monitoring requires a sensor to be attached to your abdominal area for 7 days. It monitors your glucose level 24 hours a day for 7 days and is able to predict high and low glucose events and send alerts to the user. It requires calibration with finger prick glucose once every 12 hours. It is useful for people with hypoglycemic unawareness to monitor their glucose better, as there's a predictive function for low blood glucose event. This will allow them to have more confidence in self-management of their glucose. However, it can be expensive and provide a short duration of monitoring. Many people may be familiar with the finger prick glucose test using a glucometer. However, for people who are visually challenged, it is difficult for them to read the value on the screen of their glucometer. Audible glucometers are specially designed for people with visual challenges as they read out the blood glucose value to the user. However, such devices can be expensive and bulky. An example of such device is Prodigy Voice, which is only available at Singapore Association of the Visually Handicapped. Having discussed about blood glucose monitoring, have you wondered if there's any devices which can assist with your insulin administration? Many people may be familiar with insulin delivery using syringes or pen. However, a small group of people may require additional assistance in administering their insulin. Insulin pump can be in place for insulin syringes and pen for people who require very precise dose adjustment to their insulin doses to prevent high and low blood glucose. Ultimately, the user is still in control of the insulin delivery. This device includes a cannula that is attached to your abdominal area and the circuit needs to be changed every 3 days. Some insulin pumps have additional features such as ability to predict low blood glucose event and stop the delivery of the insulin. It is useful for people who require precise dose of insulin. It allows the user to set different rates of insulin infusion at different timing, thus allowing greater flexibility with various food and exercises. This also reduces the episode of severe hypoglycemia. However, it is expensive and there is a steep learning curve. Frequent blood glucose testing is also required from the user, so the accurate insulin dose can be recommended by the insulin pump. A simpler device called the Smart Insulin Pancake is available to help remind users on the time lapse since their last insulin injection. Smart insulin pens, when paired with a smartphone application, can help track insulin doses and administration time. It can also help to provide useful reminders, alerts, and reports to the user. Both the smart insulin pen and pen caps are useful to remind people of their last dose of insulin. This will help to reduce the risk of double dosing or missing doses. However, both the smart insulin pen and pen caps are not suitable for people who are using insulin syringes and valve for administering their insulin. Next, we shall look at what are some of the applications which you can use to improve on your diabetes control. Our Singapore Health Promotion Board HealthHub apps and website is a one-stop hub which has trove of information on common illness and chronic conditions. It allows the user to access their health and vaccination records, view their lab results, and display upcoming medical appointments with the public institutions. It also allows the user to submit consent forms for MediSafe application. For people living with diabetes, there are numerous handy pocket guides to guide you on the diabetes journey. These can range from knowing how your insulin works to recognition and self-management of hypoglycemia and proper food care to prevent infection of your feet. For people who do not have diabetes, the Diabetes Risk Assessment tool on the website is also useful to help you predict your risk of developing diabetes. It also provides advice on what you can do to stay healthy. The Diabetes Hub has a collection of guides and videos to guide you in your diabetes journey. These range from being aware of a condition, eating right, how to adopt an active lifestyle, and tips on how you can control your diabetes journey. There are numerous applications available such as Diabetes M, T1D1, and My Sugar to help you keep track of your blood glucose level. Some of these applications have additional features such as an insulin dose calculator to help users understand the correctional dose of insulin required. Although it requires some learning, they are generally easy to use. For people who are working to achieve a healthy life, healthy weight, there are applications such as MyFitnessPal to help you keep track of calorie intake and expenditure. Choose applications which include details of our favorite local dishes such as laksa, lontong, chicken rice, or biryani. This will help you keep a more accurate record of your food diary. However, not all applications allow users to monitor their blood glucose level, and a separate application may be required. Did we mention the importance of maintaining a healthy lifestyle already? There are numerous applications available to help you keep fit. Some of these applications provide instructional videos on exercises. The Singapore Health Promotion Board Healthy 365 app even reward participants by choosing healthy options and achieving a target step count. As a gentle reminder, do remember to monitor your blood glucose before and after exercise. Consult your doctor on dose adjustment of your diabetes medication if needed. Besides adopting a healthy lifestyle and taking medication regularly, it is also important to keep track of your medical appointments. However, in light of the evolving COVID-19 situation, have you ever wondered how you can reduce your physical trips to the clinics? In line with the MOH recommendation for safe distancing measures, telemedicine is available for patients with stable and chronic conditions. Besides telemedicine, our hospital and polyclinics have numerous teleconsultation services. Do discuss with the doctor, nurses, or our allied health partners to find out your suitability. Do take note that teleconsultation may not be suitable for patients with recent hospitalization, poorly controlled chronic condition, and newly acute symptoms. In summary, diabetes technology, when coupled with education and follow-up, can improve the lives and health of people with diabetes. Thank you.